Chairman. Dr. Goldfarb, the Association of American Medical Colleges has called for advancing diversity, equity, and inclusion in medical education. How does DEI help medical students become better physicians?
Well, I don't think it does, and thank you for that question. Again, the problem that medicine is trying to correct is this problem of disparate outcomes in healthcare. And the question is, what's the basis for it? Rather than decide that it's an ideological problem and that there's bias on the part of physicians treating patients, the real issue is access to care and patients getting access to care and patients accessing care appropriately. But once you decide that the problem is because physicians are biased, then all of this DEI regimen flows from that. And it's very unfortunate because it's wrong and it's wasteful of time, which is one of the arguments that I tried to portray in my testimony, that we're wasting time in medical school teaching more and more about these issues for which physicians have no agency whatsoever. And it also doesn't benefit the communities in whose disparities we're trying to improve. Those communities need better access to care. They don't need the faculty of a medical school going to anti-bias training.
This seems really dangerous. Harvard's medical school diversity statement says, quote, "We celebrate the multiple dimensions of diversity that each member of our community offers, including but not limited to gender identity." Do you think, Doctor, that celebrating gender dysphoria violates the Hippocratic Oath?
You know, I think gender dysphoria and its treatment has been a terrible problem in this country. In the face of European nations that have now all, almost as a block, have decided that so-called gender-affirming care has turned out to be more harmful than beneficial and have restricted it substantially. In this country, it's continued to be advocated at the highest levels of American medicine. And I think my organization has been pushing very hard against children being put through these programs. We make no position about adults. That's not our concern. Our concern is saving children who can't possibly consent to this kind of treatment with irreversible outcomes that will influence the rest of their lives. We feel very much that that should not be part of medical education and shouldn't be part of the medical care of children.
Indeed, would you say that gender mutilation of children violates the Hippocratic Oath?
Yes, it does.
Yeah, I would agree. Transgender surgeries and related medical treatments can cost hundreds of thousands of dollars. Do you think can you talk about the financial incentives to the medical industry to perform those types of surgeries?
Yes, you know, the insurance companies have been paying for this kind of care. The military insurance system has been paying for this sort of care. Our organization has a bill that we're promoting that will help those many children who have decided to detransition and seek medical care for that. And that, unfortunately, there are no billing codes, for example, for that kind of care. So this has become an economic issue as well as a moral and a medical issue as well.
Yeah, I mean, to sum it up, since medical professionals are told not to believe in biological sex, what kind of impact does that have on the medical practice at large?
Well, again, this has been a very contentious and I know very unfortunate area of contention. Our organization, again, focuses very much on the issue about gender care for children. Children cannot possibly understand what they're getting into when they agree to these kinds of treatments. Their parents, unfortunately, have been sort of coerced into this by being told that suicide is the outcome if they don't support their children in their gender transitions. The literature now shows that none of that is correct and that, in fact, these children should be treated with psychological care, and I know there have been hearings in this building before about this. These children need psychotherapy. They do not need surgery.
Yeah, thank you. Appreciate what you do. I yield back.